Okay, so you did it. You opened up your own cash PT practice, or you're a physical therapist in a cash PT practice. And now you're so excited to implement everything that you've been trained to do in CEU courses and PT school and insurance-based care. And you're excited to help patients get pain-free. I'm here to tell you that's the wrong thing to do, and you will fail as a cash PT if you focus on being pain-free. If you are concerned about that, this video is perfect for you. My name is Garcia, and I help cash pay physical therapists just like yourself be successful, thrive in business, and improve your clinical outcomes. When we look at the difference between coming from an insurance-based care to cash PT setting, everything was focused on how do I get this patient pain-free, because that's what insurance needs. I need to go from an 8 out of 10 to a 0 out of 10, or clinical meaningful results. And that was exciting when you had people go from a 5 to a 1 inside their first session. And that was so exciting. And the expectation to that patient was they're going to get me pain-free. The physician said pain-free. The insurance says I must be pain-free in order to get all these visits paid for. So everyone is focusing on pain-free or impairments that lead them to being pain-free. And so as a provider, from an insurance-based model into a cash pay model, you think, well, that's exactly what the consumer wants. Well, pain-free is what the insurance company wanted and what the physician wanted. The consumer, while pain-free was important, they weren't focusing on that. They were hoping that pain-free led them to be able to do the things that they wanted to. Now, pain-free got them to ADLs in an insurance-based model, got them to being able to live for most things, go up and down stairs. And on a cash pay model, now you're going to take that same person and move them up. Now, in insurance-based care, you couldn't go to fitness, you couldn't go to strength and conditioning or wellness services because insurance wouldn't cover that. It's no longer pain-free. But as these people in cash pay settings, they want to continue pushing the envelope. They want to continue getting better outcomes. They're going to run another marathon. They're going to do another 5K. They're going to play basketball on the weekends. And while it's not pain-free with daily activities, now they can't play basketball without discomfort on their knees. So even though they're pain-free with ADLs, now they want to be pain-free with basketball. And the reality is that most people don't care about being pain-free because they expect it's a normal part of exercising and aging. Name one person who thinks that as they go through their 50s, 60s, and 70s, says that they expect to have zero pain as they age. And obviously that's not true. And now you have to manage that. Your expectation as a physical therapist, you were trained pain-free, pain-free, pain-free. Now on a cash PT side, you have to change your framework and understand that people get it. When they're going to pay out of network, they get that they're not going to be pain-free. They're looking for somebody who understands that. And they just purely want, can you get me to fitness or wellness with less discomfort? That's essentially what they're trying to do. And when you try and offer pain-free, that doesn't align with what they're trying to accomplish. They're ADLs to fitness to wellness, and all they want to do is be able to engage in their activities without discomfort or with less discomfort. So for you, if you focus on pain-free, that patient is no longer in the expectation that they want to play basketball. They're now going to focus, well, when does my knee hurt? It hurts when I play basketball at high intensity. For you to be able to fix that is going to take a very long time. Where you need to do is change it instead is before you had 3 out of 10 pain and you were only able to play 1 time a week. This last week, you were to play 5 days a week with that same 1 out of 10 pain. Now that changes it. This person now sees success as playing basketball more frequently, jumping higher, and they only have 1 out of 10 pain. See how we view that differently? It's only a 1 out of 10, but they're playing 5 days. That is what you would want if you were having that discomfort. You just want to be able to go to the gym, work out, and you're okay with a little bit of background ache and discomfort. And that's what patients want. And you as a physical therapist aren't used to that because you're used to offering and selling and delivering on pain-free. In a cash pay setting, this is all they're looking for. They get it. That's why they're going out of network, because their insurance would only take them to ADLs. Now they're willing to go out of network because they want to go to the fitness and the wellness side. That's why they're paying you. And you as a physical therapist, you're the problem. The consumer is saying, I expect discomfort. You're like, well, I want to keep you pain-free. And they're like, but I know I'm going to be uncomfortable. And you're like, I want pain-free. Why? Because that's the only thing you knew. And once you can understand, it's your job to see it from a bigger picture and help that consumer get to their fitness, get into their wellness with a little bit of discomfort. And that's okay. And that allows that consumer, that patient, to do more in their life. Because if they expect pain-free, they're always going to be pulling back and afraid to do things. Now, allow them to challenge things, to challenge their body, run an extra 5K, run that marathon, do that CrossFit competition, do do the rock climbing and be there to support them, because those are new aches and pains, and help and support them as you push them along life and you allow them to push themselves. And they never thought that that was normal. Now you're saying, listen, you're always going to have aches and pains. Why don't I help you through that process so you have less? That sets you up to be a better clinician and help them as a healthcare provider long term. So don't suffer and don't offer and tell them pain-free, because that's not what they're looking for. So next time you say, I'm here to help, what are you looking for? Don't focus on pain. And that will help you inside your clinical practice.